Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you are just joining us, we are talking about foodborne illnesses. Express Care's Dr. Jitka Lom is here giving us some great tips on how to avoid getting sick with those foodborne illnesses. Let's get to some of our viewer questions now, Doc. What is the most effective way to wash my hands in order to get rid of germs? Vince from Telefofo writes.
Oh, thanks, Vince. Okay, let's wash our hands with warm water and soap. It doesn't have to be antibacterial soap. It just should be any kind of mild soap, and you soap up your hands and then sing the happy birthday song, which takes about 20 seconds. Most people, if you really time yourself, you're washing your hands for 5 or 6 seconds only. So you need to wash your hands for a little bit longer, rinse them, and if you have a nail brush, if your nails are dirty, make sure you clean under your fingernails too.
And then well, I guess another part to that is drying them.
And drying them, yeah. If you have paper towels, of course, or otherwise with a clean towel. If your hands are dirty, then throw away the towel and wash it. And the other thing on that is hand sanitizers. Hand sanitizers just kill some bacteria, not all, and most viruses they do not kill. So there's something to be used if you don't have access to running water or a sink, just in basically a stopgap measure. Otherwise, you should wash your hands at a sink.
But otherwise, you've mentioned that's kind of just rubbing the bacteria all over. All right, Lynn from Tiamat asks, what is pasteurization? Once something has been pasteurized, can I eat it uncooked?
Oh, great question. So pasteurization is a way of minimizing the amount of bacteria in food. There's still some, but hardly any. It's not sterilizing, it's just heating the food to a temperature of, let's say, 160, boiling is 212, but 160, 180 degrees Fahrenheit for a brief period of time, 15 seconds or maybe up to 30 seconds at the longest. And what that does is it kills off the majority of the bacteria, so the food can be preserved longer. Typically, milk is pasteurized and other dairy products can be pasteurized. That just means, though, they have a longer shelf life and you're less likely to get bacteria. But of course, if you leave your milk sitting out for a couple hours on a hot day, you can be sure that there's something growing in it.
Ugh, all right. Steve from Manila asks, am I putting myself in danger by eating undercooked beef? And you were talking about Kelaguen earlier, and I think that's one of the reasons why I can't eat it, because I know technically it's not cooked, even though the lemon is cooking it.
Yeah, it's not cooked to a temperature which destroys bacteria. It's basically coagulated with, the proteins are coagulated with the acid in the lemon and the vinegar. But it's not cooked where you would destroy bacteria. So as far as the beef, you can get many diseases from uncooked beef, and typically that's E. coli, terrible diarrhea with blood in it, and salmonella you can get from uncooked beef. You can get viral illnesses. You can get a whole lot of stuff from uncooked beef. So you have to be sure that the beef has been purchased from a reputable place, it's been stored properly, it's fresh, and that you eat it promptly if you're going to have half raw meat.
All right, sounds good. Matthew from Jigo asks, my doctor said I have acute gastroenteritis.
Yes.
What does this mean?
Okay, so again, that would be inflammation of the stomach and the intestines, gastroenteritis, and people call this stomach flu. It's not a flu, it's basically a viral illness or sometimes a bacterial inflammation of your intestines.
Okay, and how long does that normally last?
Well, depending on what's caused it, it could last a day or two, or maybe even up to 2 weeks, even several months if you get a terrible bacterial infection that takes a long time to clear.
And we didn't talk about this earlier, but how do you deal with it? What do you do?
Well, it depends.
What's the best way?
So let's say you pick up a viral norovirus. There is no treatment, just supportive hydration and IVs if you need them, but otherwise lots of liquids. Whenever you have a stomach or inflammation of the intestines, you shouldn't eat much. You should just hydrate, lots of fluids. No milk, no dairy for sure. And so supportive treatment like that. For bacterial infections, you can sometimes take antibiotics. So for traveler's diarrhea, for salmonella, for the E. coli, there are antibiotics that you can take. Of course, there's always a problem there because you take antibiotics, you wipe out all the good germs as well as the bad germs, and then you might have other problems from that. So best to avoid it in the first place. Wash your hands.
Amen to that. Tracy from Dededo asks, I am 6 months pregnant. My doctor has warned me about listeria. What is it and how do I get it?
Listeria is another bacterial infection that pregnant women and elderly, frail people are more prone to. And you can pick up this germ from typically hot dogs and deli meats, soft cheeses like brie or camembert, and then cantaloupe, and also from raw seafood. So these are foods that you should avoid as a pregnant woman. You should eat well-washed and fully cooked foods. The tragedy of listeria is sometimes the woman does not feel sick. She does not have vomiting or diarrhea, she doesn't have anything, but the bacteria has traveled through the placenta and infected the baby, and it can cause miscarriage earlier on, or terrible infections in the unborn child, even death. So a very, very important thing for pregnant women to know.
All right. Our last question comes from Betty from Santa Rita. Is it risky to eat raw fruits and vegetables?
Well, we always want to eat raw fruits and vegetables because they're healthy, but they need to be washed. So it's not good to just spray them with the vegetable spray, or, you know, eat them directly out of the supermarket. You've got to take them home. You can soak them in a tub full of water and scrub them. You can get a little brush just for that, and wash your vegetables really well, especially cantaloupe or the melons that have a thick rind where you can have bacteria and viruses and even fungi sitting around for a long time. So give your melons and things that you would normally not think of because you're going to just peel them or cut off the rind, oranges, you should wash all of those fruits and vegetables before eating them.
Oh, interesting. That's good to know.
Yeah.
All right, so make sure you wash your hands, sing the happy birthday song, warm water, soap, and just make sure you keep an eye out at the restaurants that you go to and hope that they're clean.
Yes, and if you're somebody who works in the restaurant, make sure that you take that responsibility to really wash your hands, especially after using the restrooms. Take your time and really keep your hands clean.
And I wanted to ask you one last thing is, I've heard that when you have the stomach bug or gastroenteritis or a foodborne illness, you lose a lot of fluids, obviously. So is it good to drink Gatorade?
Yeah, you can drink. Yeah, you can drink Gatorade. You can drink, you know, the vitamin water and that kind of stuff. But just any fluids, especially water, would be most helpful. People want to replenish their electrolytes, and you can do that pretty simply by eating a small amount of food with it. But you should definitely never ever drink dairy, even the yogurt, when you have a stomach inflammation going on or intestinal problem.
All right, Doc, thank you so much for all that great advice.
Yeah.
And just a quick reminder to stop by Express Care on the second floor of the Agania Shopping Center. It is not too late to check out their Sweetheart specials, getting our special someone a gift, or your special someone a gift certificate for Valentine's Day won't only make that person happy, but they could also be entered to win a prize package valued at more than $2,000. So make sure to stop in soon. Dr. Lom will be back again next week, and we will be picking up our discussion on amazing glands, your pineal and pituitary, excuse me. So if you have any questions, send it to healthyliving@kuamnews.com. We're back right after this.